Blame the governors for the death of grandma. That's what we're hearing from the New York Post here, and I think I concur. So this is from the New York Post. Michael Goodwin, blame governors for the coronavirus deaths in nursing homes. An article in Nowhere magazine several years ago explored the ways ancient culture dispatched the elderly, a practice known as sinecide. Author Justin Nobel recounted several gruesome rites that made the Inuit habit of putting Granny on an Arctic ice floe seem humane. At one point, Nobel mentioned that his own grandparents had moved to a fancy nursing home in the suburbs of New York City. That made me shudder. Well, yeah. I wonder if his own grandparents are still there now. If they are honest, historians judging the American experience during the coronavirus pandemic will excoriate our barbaric failure to protect the elderly. We think of ourselves as civilized, but mindless policies and bureaucratic indifference turned many nursing homes and rehabilitation centers into killing fields. Ah, they're using the old Cambodian Pol Pot language there, which it might not gonna be quite the numbers, but it's pretty bad. At least 28,000 residents and workers in long term care facilities have died from the virus, according to a New York Times analysis done more than a week ago. That represented 1 out of every 3 COVID 19 deaths recorded in the United States at the time, and was likely an undercount because of the reporting lags and varying state methods. This massacre of a helpless population shames America, and Washington must find out why it happened and who is responsible. It's going to be the governors. Elderly people in these institutions could not protect themselves, and because most states banned visitors early in the outbreak, the institutions, their regulators, and elected officials were fully obligated to shield them against the infection. They failed miserably. The Times found 14 states where more than half of the total deaths occurred in facilities for the elderly. It was 50. Oh, it was 55% in Connecticut, 57 in Colorado, North Carolina, and Kentucky, 58 in Virginia, 59 in Massachusetts, 61 in Delaware, 66 in Pennsylvania, 73 in Rhode Island, and 80% in West Virginia and Minnesota. The states with the most nursing home deaths, New York and New Jersey, didn't make the list because of so many other deaths. Yet more than 10,000 people died in their facilities. The 5,500 nursing home deaths in New York are more than the total deaths in all other states except New Jersey. Many, if not most, could have been avoided. The earlier outbreaks in Asia and Europe demonstrated early that the elderly were easy prey for the virus, doubly so when you have underlying health conditions. Everyone knew that. Florida got the message and implemented a model response. Despite its vast enclaves of long-term care homes, it reported under 750 deaths in them, or slightly more than one for each of its 615 facilities. So you can obviously tell that the way Florida handled it, with Governor Ron DeSantis, did not spread like wildfire. The striking contrast between Florida on one hand and New York and New Jersey on the other hand can be traced largely to policy decisions by their governors. Governor Andrew Cuomo of New York and Governor Phil Murphy of New Jersey issued almost identical orders in late March requiring nursing homes to accept COVID-19 patients after being discharged from hospitals. The orders barred the homes from even asking if the patients had the virus, lest they be discriminated against. So while all of these Democrats and lefties were telling us that if we went out and we opened up our business and if we didn't wear masks or if we wanted to go out to eat, we were going to be killing grandma, meanwhile, they were killing fucking grandma. The Democrat Party needs to be disbanded. It needs to be disbanded, and a lot of these officials need to be Guantanamo'd, never heard from again. We got to start making examples of these people. All right. Those politically correct orders quickly became death sentences as infections spread like wildfire. Florida, thankfully, followed a different path. Governor Ron DeSantis said his state moved early to protect the elderly because statistics from South Korea showed that not all age groups were equally at risk, and that most deaths happened to folks 65 and up. As a result, he allowed his nursing homes to reject hospital referrals who were still infected. More recently, Florida started sending infected residents in the opposite direction, from nursing homes to hospitals. Our goal is to keep the virus out of our facilities, one Florida nursing home CEO told the Sun Sentinel. Hospitals are more concerned about their beds. Because Cuomo and Murphy had the same information as DeSantis, their ruinous actions remain inexplicable. They can't say they weren't warned. That's damn right they can't. Damn right they can't. On March 8th, Dr. Thomas Frieden, former head of the Federal Centers for Disease Control and Prevention, wrote on CNN that nursing homes and other long-term care facilities are ground zero. March 8th, before the shutdown. On March 18th, the CDC, in a study of the nation's first large outbreak in a nursing home in Kirkland, Washington, told health officials substantial morbidity and mortality might be averted if all long care facilities take steps now to prevent exposure to the residents to COVID-19. Yet 7 days later, Cuomo issued his infamous March 25th order that said no residents shall be denied readmission or admission to NH solely based on a confirmed or suspected diagnosis of COVID-19. What are these people thinking? We all knew. We all knew that Granny and Gramps were the most likely to die from this. And what did he do? So we shut down schools so that people in schools wouldn't infect each other. The young, colleges, schools, teenagers, kids, and people in their young 20s, so that they wouldn't get infected. There was a reason we did that. And I'm not saying I fully agree with it, but we knew that the grandparents, the elderly, they were the ones that were most at risk, and we just completely said open season for them. I mean, there's got to be criminal charges with it. I mean, at the very least, this is manslaughter. This is criminal negligence. Criminal negligence. 6 days after that, on March 31st, Murphy issued similar language in his order. Although it allowed carve-outs that enabled some facilities to dodge the bullet, the mandate had disastrous impacts overall, with more than 5,000 deaths recorded in New Jersey's long-term homes. One of the worst in the state was one of the worst is the state-run Veterans Home in Paramus, which has recorded at least 72 deaths. A man lost his 91-year-old Army veteran father. There was quoted as saying, "The home should be demolished and replaced with a memorial park. It's like a mass shooting." Holy shit. I mean, and they had the gall to sit there and say that we're killing grandma because we want to go out and live our lives where the elderly could perfectly well quarantine themselves. Yet in the places where the elderly were supposed to be quarantining them, they were essentially injecting the virus into those homes. Despite the surging death count, Cuomo defended his directive for more than 6 weeks. He reversed himself only last Sunday, ruling that patients must test negative before hospitals can send them to nursing homes. Yet he insisted that the initial policy worked. What world do these people live in? How warped does your sense of reality have to be to think that that policy worked? Or, okay. Let's go by his assumption that the policy did work. Let's say the policy worked. Worked for what? What was the aim? If it worked, that means it achieved a goal. So what was the goal? Now, all of a sudden, you might be able to bump that murder rate up to first degree. If the goal was, if he's saying the policy worked, because all it did was kill the elderly. If that's working for him, if that's what defines the policy working, then what was the motive? Or what was the intended purpose? Was it to kill all the elderly? Starting to look like that might be a possibility. Disgusting. Sorry, I gotta relight my cigar here before we get going. I get on these rants. Getting revved up. All right. If more than 5,000 dead was a success, what would failure look like? I mean, it sounds to me like failure would have looked like nobody dying. I think maybe what it was that we know that they've been padding the coronavirus numbers. We know that even people who have died of gunshot wounds have been marked as COVID deaths, which is also interesting. Just a little tangent here, so bear with me. If somebody gets shot to death, they get murdered, and then they go to the hospital, they test positive for COVID, and the hospital marks the cause of death as COVID, does that mean the murderer just gets away with it? Because you can't charge somebody for killing somebody with COVID. Well, actually, I don't know. Maybe we can charge somebody with killing someone with COVID. Maybe Cuomo will be the first one. He should be. Cuomo's reversal included forcing nursing homes to test staff and administrators twice a week at the home's own expense. There was no explanation why testing was not required all along, or how it would work when labs say they cannot process the needed 410,000 weekly tests. Despite the enormous consequences of Cuomo's arbitrary decision-making, only a few New York lawmakers have dared to call for investigations about what went wrong. They need to all call for it. But again, as I talked about in my Berman, my article, or my hip shot video about Berman, they cover each other. These Democrats cover each other. These Democrats need to go. The party needs to be dissolved. Most of them need to be shipped off to prison, shipped off to Gitmo, or just, taken out onto a boat and torpedoed. Whatever we need to do to get rid of them. Whatever we need to do. All right. Nursing home executives, meanwhile, complained privately that Cuomo should have known his mandate would be a killer. He did know, but they were never consulted. They were never consulted and got no notice before being swamped with infected patients. Oh my God, this gets worse and worse. As one owner put it, longtime residents began dropping like flies soon afterwards. No shit, of course they did. These same executives will not go public with their complaints because they fear Cuomo will punish them with fines and take their licenses. All right, this is the authoritarian state. I mean, this is scary. This is scary. The amount of power that these Democrats have consumed, or that they've centered around themselves. You now have people that will not even complain about policies that de facto mass murdered a bunch of old people, and they're afraid to speak up about it because they're afraid that that same governor that instilled those policies that caused all those deaths is going to punish them for calling them out on it. First of all, that's insane that these Democrats are, for one, that bitter. I mean, these people need to own up to their mistakes. But it's also insane that people aren't standing up. You know what? Take the consequences. Do the right thing. Do the right thing. Grow some balls. I put out these videos. I work in two very left-wing industries, and I still put out these videos because I got to do my part to speak my mind, get information out there, and expose people who might be going down the path towards being brainwashed by leftism, give them counter-arguments. I'm risking myself every time I put one of these videos out. I don't give a shit. Do what you want to me. You're not going to silence me. Stand up, people. Stand up. Let's see. Some executives will not go public. Some see the sudden testing regime and a probe he started with the state attorney general as a way to blame them for his mistakes. You know he's going to blame them for his mistakes. That's what Democrats do. They fuck everything up and then they project it onto their political opponents so that they look scot-free, and then they have the media to back all this up. Thank God for the New York Post. They're usually pretty good. They're usually pretty decent. I mean, I'm not going to say everything that they put out is gold or anything, but a lot better than the New York Times, I'll tell you that. All the more reason why federal officials with nothing to fear must step up and find the facts. Yes, none of us should fear the left. We should not fear the left. We're Americans. We don't goddamn cower. We make commies cower. We make people on the left cower. We don't bend the knee. A designated U.S. attorney, for example, could use a grand jury to demand answers about why the elderly people were put in harm's way despite the warnings and simple common sense. Yes, simple common sense. The simplest of common sense. This is simple Jack-level common sense. As for witnesses willing and eager to come forward, the Fed should start with grieving families. Yeah, I'm sure there's going to be a lot of people there that are willing to burn it all to the ground. For each of the 28,000 dead, there are relatives whose stories of heartbreak and rage will move the nation. The families want answer, they want actions, they deserve both. Yes, they do, and I damn sure hope that they get it. It's enough for this one. Thorburn out. Actually, I need to resume because I forgot one other thing. Another little piece of corruption for this one. So, similarly related, we have also from the New York Post, Pennsylvania health official moved mother from nursing home as death skyrocketed. She looks like a shining example of a health official, doesn't she? So it's like the health minister from Belgium. You ever or Belgium? You ever looked up her? She is the spitting image of morbidly obese. All right, so the official health response, the health official responsible for overseeing nursing homes in Pennsylvania, where nearly 70% of the state's coronavirus-related deaths have occurred, has reportedly moved her elderly mother out of a facility as deaths skyrocketed. Health Secretary Dr. Rachel Levine said Tuesday that her 95-year-old mother requested to be moved out of a personal care home, the ABC affiliate in Harrisburg said. My mother requested, and my sister and I as her children complied, to move her to another location during the COVID-19 outbreak, says Levine. My mother is 95 years old. She is very intelligent and more than competent to make her own decisions. After criticism from state lawmakers for the move, Levine argued she's working to ensure the health and safety of all state residents. All right, see, I didn't really want to read this whole article. The whole point of me pulling up this article in reference to that last article was that these people know what they're doing. These people in charge that are making these decisions, they know what they're doing, and they're gonna take their own mothers out of these care homes. They're not gonna let you take yours. In fact, I heard stories of some people that tried to get their parents out, and they wouldn't let them leave. They wouldn't let them take their parents out of the homes. Yet the health officials, who know damn well that these orders from these Democrat states, all of the instances of these nursing home orders where they just let COVID run free in nursing homes, all Democrats, all Democrat governors. And so now we have the Pennsylvania health official. She knew it was up. She was perfectly fine taking her mother out, but you and yours? No. And again, that is the corruption of rules for thee, but not for me. And these Democrats live by it. We've seen it with the enforcement of the law in New York. People want to open up their business, jail. You want to riot and burn down that business, we're not even going to arrest you. Fucking bullshit. All right, this time, legitimately out.